So yes, good morning, and thank you for joining us today, everyone, this October 24th for this town hall on COVID-19. Um, Again, there is a captioning button for attendees who would like to see closed captions on the bottom of your screen. You'll need to click it and activate the closed captioning. My name is Dominic De Los Reyes, and my pronouns are he and they. I'm the program manager for the Community Health Worker Communication and Outreach Services, shortened to CHWCOS, at the Union of Pan-Asian Communities, or UPAC. CHWCOS is funded by the County of San Diego in support of the Live Well San Diego vision for healthy, safe, and thriving communities. And with support, uh, we aim to provide San Diegans, especially from Asian and Pacific Islander communities, with support and resources to prevent and slow the spread of COVID-19. So this virtual town hall is welcome to everyone and aims to provide COVID-19 updates and local resources, as well as to hear from the community and answer your questions. I'd like to recognize Lucy, Annette, and Sarika Mehta for providing American Sign Language interpretation for this event, and Bayanihan Guevara for providing live captioning services. Thank you for helping to make this an accessible event. In addition, community health workers are present with us to assist with translation for attendees who wish to communicate in Karen, Tagalog, or Vietnamese. There will be a presentation followed by a question and answer session, and I'll try not to take too long on the presentation to leave space for the questions. If you let's see, the data in this presentation is accurate as of this Monday, October 19th, unless otherwise noted. And if you have any questions regarding COVID-19 or the presentation, please type them into the Q&A box and we can process them together. So we're recording this event and also streaming on Facebook Live. And we will also be monitoring the comments there as well if people have questions from Facebook. So for next week's town hall, the presentations will be the same, but may include some updates from the county or state as the COVID-19 situation develops. You're welcome to attend both events, as there will be unique discussions in each one, but of course you don't have to. So let's see, how do I change slides? Here we go. Who are the community health workers, right, on this CHWCOS team? They are Grace Thaw, who specializes in working with the Karen people and refugees from Burma. Tracy Lee, who specializes in working with the Vietnamese community and also provides family case management. And Jeanette Lucas, who specializes in working with the Filipino community as well as with older adults. As members of some of the communities we serve, the UPAC CHWCOS team is invested in providing culturally and linguistically appropriate communication on COVID-19. We are mobile and available to contact directly through the email addresses and phone numbers listed on the slide. And also UPAC is a nonprofit that since 1974 has provided health and human services to underserved Asian, Pacific Islander, Latinx, Middle Eastern, East African, African American, and other populations of San Diego County. UPAC programs include mental health services, addiction treatment and recovery, community engagement, also housing support. Sorry, one moment. And business development. UPAC staff collectively speak over 30 languages and dialects. So CHWCOS is also able to support in these languages. Today, we will be talking about COVID-19 and It's been several months since the World Health Organization declared a global pandemic on March 11th. And of course, many of our communities have experienced loss related to it. So, whatever your experience, we want to honor it in this space and reassure you that it's okay to make your mental wellness a priority. The County of San Diego has multiple resources for managing mental health and coping during the COVID-19 pandemic. One of them is the San Diego Access and Crisis Line, which is confidential and free of charge. The line is immediately answered 7 days a week, 24 hours a day by, master's level and licensed clinicians. Language interpreter services are also available to assist in 150 languages within seconds. And there's also a text chat feature online. In addition, we can provide referrals to other mental health resources available in your area. And on the county website, there are reading materials as well that we can share. So I just wanted to start with a map that is from the Centers for Disease Control and Prevention. And it shows the ranges of COVID-19 cases in the United States and territories that were reported from October 14th through the 20th of this year. And so this map shows that California is in the darkest color category, meaning it has among the most cases reported within those 7 days compared with the rest of the country. So basically, recent data is showing that the numbers of cases are going up, and this is a real problem that we are faced with. As of yesterday, there are now more than 8.4 million recorded cases of COVID-19 and over 223,000 recorded deaths in the United States. And so just to share a little bit about COVID-19, the full name of it is, sorry, I lose my place sometimes. 1 second. The severe acute respiratory syndrome coronavirus disease. And this was identified in 2019, and it's also known as SARS-CoV-2. So there are several types of coronavirus that can infect humans. And although some are common and usually mild, COVID-19 is the newest type of coronavirus. And people infected with it have a wide range of reactions, from having no symptoms at all to some symptoms that can be managed pretty well at home. But some also need immediate hospitalization because they get severe symptoms. They can also spread the virus to others, even if they have no symptoms, or up to 2 days before they show symptoms. They can be contagious and not know it. So currently there's no cure for COVID-19, but while scientists are developing vaccines and other treatments, we can help to protect ourselves and others by taking preventative actions and supporting the body's own healthy functioning and immune system, right? Luckily, though, the County of San Diego, in collaboration with the local healthcare provider community, first responders, and stakeholders, is implementing a community-based intervention to reduce the impact of COVID-19 in our region. So the goal is to increase educational, economic, and social activity while minimizing COVID-19 infections, illnesses, and deaths through a robust plan to test, trace, and treat. The T3 strategy is what they're calling it. And there's a lot of text on this slide, but I wanted to basically talk about the importance of testing. So in the red box here, there are a list of some symptoms that you might experience if you get COVID. But you might also have been exposed to COVID and not develop any symptoms yet. So if you think you may have been in contact with someone who has COVID, meaning spending maybe 15 minutes or more with in close contact with someone who is positive, even if both of you are wearing a mask, but if you're within 6 feet of each other, basically, there's a chance that the droplets from breathing or singing or talking from the person infected with COVID could have passed to you. And if that's the case, you could be incubating the virus and not know it. So everyone is encouraged to get tested for COVID if you think you may have been exposed or if you have symptoms, but also if you're in a higher risk category. For example, if you're 65 or older, or have immunocompromised conditions or underlying medical conditions. Please call your healthcare provider so that they can determine next steps. And if you do not have a healthcare provider or health insurance, you can also call 211 and speak to a provider there who would be able to refer you to get tested and give instructions for you to stay home in an isolated room, especially until you get the results back, which may come 1 to 3 days from when you get tested on average. And also call your provider immediately if symptoms get worse. On the bottom of this slide, there are a few symptoms that you should call 911 for, especially if you're having trouble breathing, pressure or pain in your chest, bluish lips or face, suddenly feeling confused or having trouble moving, waking up, staying awake. These are all immediate signs that you need to be seen by a medical professional. Because it might mean that, for example, you are not getting enough oxygen. And that's one of the ways that COVID can affect the body. So also, one of the good things that come from as many people as possible getting tested is that the county can collect data from that around how many of these tests come back positive. And that is just one of several ways that the county measures using mathematical modeling how restrictive the economy should be on our activities with each other so that collectively we can minimize passing and spreading the virus. So I'm not going to really go into the details of what's on this slide and the data, but just to show you, the county has ways of measuring, for example, which tier our county is in. We're in the red tier, which means that it's based on the positive case rates per 1,000 people. And the other statistic there, testing positivity percentage. In coordination with that, this map can show that in California, more and more of the state is becoming purple, which means the COVID is kind of uncontrolled spreading, widespread. And we are in the bottom left corner in the little red square here. That means we're still in tier 2, but as you can see, pretty much all the counties around us have a worse problem with COVID than we do. So we might anticipate needing to have more restrictions in our economy in order to try to deal with the spread of COVID. And what are some ways we can do that? Well, the best way to prevent getting sick is to avoid being exposed to the virus. And San Diego has public health officer orders available at coronavirus-sd.com. California also has a public health executive order. And both of them basically say to stay home as much as possible, especially if you are at high risk for health complications if you're exposed. Practice good hand hygiene and sanitation. Keep at least 6 feet apart from others. Wear a face covering, face mask. Avoid crowded places and enclosed spaces, because airflow is really important factor in the ways that COVID can spread in air droplets in the air. So it's good to, if you're going to share a room with someone, have at least 2 airflow sources, an open window, open door. If you have any air filters, try to use those. HEPA filters, UV lights. We want to layer as many preventative practices as possible to protect ourselves and others. And also stay home if you're sick. Don't host or attend dinner parties, house parties. So by following these guidelines, we can all help slow the spread of the virus. In addition, decreases in testing positivity rate and case rate lead to more sectors of the economy reopening, right? Especially for small business owners, that can make a big difference. There is also a map of testing locations on the coronavirus-sd.com website. And you can type in your address and it will show you which locations are closest for you to go. You won't need a doctor's referral, and you won't necessarily even need an appointment at a number of the locations. However, it might be good to check with the place you're planning on going to if they want you to register by going to a certain website or calling a number beforehand so they have some of your information. You can also call 211 to set up an appointment for getting tested. And we can share these resources with you as well after the presentation. So the second part of the T3 strategy is around tracing, contact tracing. The county is hiring a lot of people to do contact tracing, which means basically they will follow up with anyone who may have been exposed to COVID and test positive, and help them with follow-up steps so that anyone that they may have been in contact with can be informed and given instructions for how to care for themselves as well or get tested. And this diagram is basically showing that there's a system set up to help you if you find yourself in this circumstance or want to help someone you know in the circumstance. And also I mentioned, if you need to isolate, so for example, you do get a positive COVID test and a provider tells you that you need to isolate, or if you need to quarantine, meaning if you have been exposed to someone who has positive, the county has a temporary lodging program so that you can get a hotel room to stay in during the 2 weeks or however long you need to keep yourself separate from others so that you don't spread the virus by accident. You can call 211 for more information about this program to see if you're eligible, and they will also feed you 3 meals a day and clean. So people are very careful about this process and this program. You can call that number to learn more about it. I also wanted to share a few resources too about food distributions for families that may need some extra food help. UPAC has a distribution of care boxes and groceries every Friday in Mira Mesa at the Neighborhood Enterprise Center. This address is 5296 University Avenue in San Diego, zip code 92105. Call ahead so you can reserve your box, 619-788-1480. And we also work with several community partners who are doing food distributions of their own. For example, South Bay Community Services has multiple food distribution sites on different days of the week. And for more lists, you can go to san diego foodbank.org, get help. On the coronavirus-sd.com county website, there are also more food resources there. And I also wanted to share a few other things that folks might not know they could benefit from. There is a COVID positive recovery stipend program where if you are eligible for it, you can receive money to help you isolate at home and not take as much of a financial toll from it. These are for people who are not otherwise eligible for paid time off from their employer or state unemployment. For small business owners, there's also a stimulus grant program. The county is providing economic assistance so that the COVID-19 restrictions on the economy are not forcing businesses to close and go out of business. So that program can help with that. There's also Great Plates programs. The food distribution sites I mentioned before are places you would go to and pick up groceries, but Great Plates programs are able to do delivery to eligible folks who are signed up with their program. So you can call their number 1-800-339-4661 or apply online through the coronavirus-sd.com website as well. There are clearly a lot of resources at that website, so I encourage everyone to browse it if you have time. And on top of that, here are some other websites. California Coronavirus Response, Department of Public Health, Centers for Disease Control, otherwise known as CDC, has good information on COVID, and also the World Health Organization, because again, it is a global pandemic. And you can also visit 211sandiego.org for more information about resources that are local and free and available. Also, if you notice anyone not wearing their face mask properly, there is a hotline that you can report a face covering violation to, also through 211 to get that number. If you like to receive text updates, you can text COSD, which is probably short for County of San Diego, COVID-19 to 468-311, and you can get updates that way as well. So I know we've been talking about COVID this whole time, but I also want to remind everyone that you can also get your flu shot. We are still in the middle of flu season. It's possible to get COVID and the flu at the same time, which would not be good. But the county also has a lot of flu shot clinics available. These are just a short list of some coming up immediately, but you can also check out the QR code on this slide for more opportunities to get your flu vaccine, as well as calling 211. They'll be able to help you with that as well. So I know I presented a lot of information and I want to get to our questions soon, but this is just kind of a quick checklist to start thinking about what we can do next, to prepare in case our county is going to need to restrict our activities more for the sake of managing the COVID outbreak. Depending on who you're living with and who you take care of, I want to check on your family and your housemates. if you don't have a place where you or others can isolate if you need to, um, check out the temporary lodging program. Also ask family or friends if that's something you can navigate together. And also check on yourself. A lot of us spend so much time and energy caring for others that sometimes we forget that we are also just as important and need to take care of ourselves. So have you drunk water recently? Um, might you be experiencing any symptoms that it might not be convenient for you to have them, but we really want to encourage you to talk to your healthcare providers and get the healthcare that you need. Um, with assistance, scheduling appointments, or if you need any case management, we can also connect you to community partners and other UPAC programs that can assist with that. And also, we encourage you to take inventory of things that you have where you live. Do you need to go get more cleaning supplies, disinfection supplies? Anything that in case you need to isolate or quarantine or anyone in your family, will there be enough food for that so that there's no need to go out and get it? There are also programs to help with this as well. CHWCOS has a few hand sanitizer bottles and masks, and we can also connect you with other preventative hygiene supplies as well. And also, hopefully after today, we encourage everyone to share what they learned with others, because you never know who could also benefit from this information and would not have heard it otherwise. So we encourage everyone to stay connected, get involved. If you like to volunteer, there are plenty of opportunities, mutual aid networks, and feel free to stay in contact with us after today. So yeah, at this point, let's open it up to everyone's questions. If panelists, the rest of the CHWCOS team would like to answer any themselves, feel free. I'm going to stop screen sharing so that I can also see the Q&A window now. Hi, this is me. Okay, so one question I'm seeing here. Oh, which one has been answered? Okay, it says, what if multiple homes in my neighborhood are having parties and no one is wearing a mask, but they are outside? I won't call the police, but I also want my neighbors to be safer. What should I do? Any community health workers? You are often out in the community talking with people and answering their questions. Is this something that you have been asked by other residents of San Diego County? And if so, what kind of resources can we connect them with?
Dominic, can I talk? I can answer the question that AT had on here. Actually, if you are uncomfortable calling the police or reporting them, you can just gently remind them, like to keep 6 feet distancing, even if they're within their family members, or you can just give them flyers that we that we have available, and just gently remind them about the social distancing.
Thank you. As for the county guidelines, going back to the report with the instructions for preventative measures, even if people are outside, they still are encouraged to wear a mask, especially if they'll be talking and in relatively close contact with other people. As a kind of harm reduction measure, recently county regulations changed to say that um, if if one household of people that have been quarantining together is going to be visiting with people from another household that is also quarantining together, they can do that with up to, I think, two other households. Someone correct me if I'm wrong if you know. But basically, they're saying if you're going to be visiting with each other, try to stick to the same people over time. And that way, it's less likely that the virus will be introduced to this whole group. Also, try to limit your visits to less than 2 hours at a time and still maintain all of those other precautions that I mentioned on the slide before. I see also the question, family visits are important to stay connected to our family. Any suggestions on how to stay connected to my family while being safe? Yes, I mean, it has been a big disruption for everyone to be asked not to see each other in person, especially when that's a very common and valuable thing for families. Um, so, in addition to taking precautions while visiting in person, there are so many ways nowadays with technology that you can uh, connect with each other online with video and games you can play with each other, shows you can watch at the same time, and it'll feel like you are there with each other. So yeah, we want people to stay in communication with their loved ones and friends. Um, we just need to be creative about finding ways to do it in a way that is um, not putting yourself and others at risk of contracting COVID. And anyone else, also panelists, feel free to jump in. There's a question here that says, um, how can I safely go grocery shopping? There are a lot of people at my marketplace, and it is sometimes difficult to stay 6 feet away. Yo, I have the same problem. And it's difficult, right? Sometimes getting groceries delivered isn't a feasible option if because of cost or not all stores provide it, um, or the need to wait for it to be delivered. So again, we just encourage that if you have others that between the group of you, um, anyone can go shopping on behalf of others, try to kind of have as few people as possible going to the store to get supplies for as many people so that there's less potential exposure, right? Um, the CDC, I believe, has here, never mind. Let me say that on the county website, there are instructions on steps you can take as well. If anyone of the panelists wants to pull that up, you don't have to bleach every surface of every grocery item that you bring into the house. Um, the authorities are saying that it's not uh, necessarily one of the common ways that COVID is spread from person to person. It's mainly through contact with vapor droplets, aerosolized droplets, or on surfaces that are commonly used and touched by people, such as TV remotes, cash like dollar bills, um, cell phone screens. These are things that we want to clean frequently and disinfect. Um, I try to also give myself a lot of time for the grocery trip when I do go, so that in case there's people by the part of the aisle where I want to get something, I can wait for people to get out of the way before going there myself, and just trying to stay 6 feet away or more from people as much as possible. I know that there are some restrictions depending on the tier we're in, where stores are required to only function at a half or a percentage of the capacity of shoppers in the building at a time. Um, and ideally, if you can go places where there's good airflow, these are all some uh, measures that might be helpful. But if others also want to add to that, I believe you can comment on the questions or answers if they're being typed in.
Hey, Dominic, I would like to add to the question, how can I safely go grocery shopping? There are a lot of people at my marketplace, and it's sometimes difficult to stay 6 feet away. Um, I want to emphasize for those owners of the grocery shop that they should to protect them and to protect the customers. Maybe they could have the aisle a one-way trip, so the traffic is not, they will not in contact with each other, because the aisle is one way. So maybe the first aisle is go straight and then back, you know. So it they can stay the 6 feet distance away from each other. That's it.
Yes, thank you. I have seen in some places they'll put stickers on the floor to
Yeah.
show you what is 6 feet, because sometimes it's hard to gauge. So thank you. Okay, maybe we can look at other questions too. How often should I wash my face mask? Is there a place I can get free ones too? Ooh, good question.
Hey, Dominic,
CHW.
I can help question. So the CDC recommends washing your mask after each use, and you can wash it with, your laundry, or wash it in a washing machine or by hand. If using a washing machine, don't be afraid to wash your mask along with your regular laundry. So with standard laundry detergent and warm water, the cloth material of your mask can handle it. So just um, wash it after each use.
Thank you, Tracy. Yes, and if it happens to shrink in the dryer, be sure that it can still cover your nose and mouth and fit properly. Um, and does anyone have places where they can get the free face masks?
Actually, UPAC, our program, is the our program, the community health workers are handing out free sanitizers and masks, disposable masks, and if you need one, we would be willing to give you one. You can contact any one of us.
Thank you. I would also like to quickly share my screen to a slide that is a checklist from the CDC, showing about here the best practices for wearing it. Right, we want it to be fitting snugly against the side of the face. So for example, some masks have a little metal bar on top of the nose bridge. Be sure to bend that over your nose, and that way it can provide more of a seal to catch more vapor droplets. Also, it's a good mask is one that can be secured with ties or ear loops. It's important to, if you can, when you're taking it off and putting it on, only be touching the ear loops. And they're saying that because if you're breathing through the cloth material and you touch the outside of the cloth material, there's a chance that if you have COVID your vapor droplets, it can get passed onto your hands and you might accidentally spread it that way. Good masks include 2 or more layers of fabric. They allow for breathing without restriction. I know that's a complaint for a lot of people, that it's uncomfortable because it feels like you're being suffocated, but a properly fitting mask should not have that issue for you. Also, like Tracy said, it's good if they can be machine washable. And you can also hand wash it. So that's all I wanted to add to that. Okay. Oh, Grace or any of the community health workers who are seeing the live Facebook feed, are there any questions from there?
I'm checking right now and I don't see any
Okay.
questions.
Can I get COVID from someone petting my dog? It's also listed on the county website, I believe. And if not, then I mean the CDC, which is the national, one of the sources that the county gets their information. COVID is not known yet to be passed in this way from person to person by sharing the same dog that they're petting. Theoretically, right, it would happen by someone with bodily droplets on their hand with COVID in the droplets, touching the dog, and then someone else touches the dog and gets those droplets on their hand, and then it gets into their body through the surface of their skin. But it's not an issue that is being, given a lot of precaution around. They're saying if in general your dog is relatively clean, and if people's hands are relatively clean, or if you use regular hand washing, good practices, and hand sanitizer, then you should be fine, basically. There are multiple other ways that COVID can be passed that would be more likely to be the way that people become positive. A good question.
Yeah, I would also like, I read in the FDA that certain bacteria and fungi can be carried on fur and hair, but there's no evidence that viruses, including the virus that cause COVID-19, can spread to people from the skin or hair of pets. But according to the CDC, just treat the dog like human. So don't allow your pets to go outside if it's not essential. So just treat us as human.
Yeah, in the beginning of the pandemic, I remember seeing some news from international sources that people were very worried about getting COVID from their pets, and so they would get rid of their pets. Originally, all coronaviruses are common in certain animals, and some of these coronaviruses have evolved to be able to pass from animals to humans. And what makes COVID-19 so much of a problem for us is that this particular virus has also evolved the ability to easily pass from person to person. And that's how this turned into a pandemic. However, typically coronaviruses are unique to the species of animal that they come from, such as bird flu, swine flu, things like that. We have a long history of humanity having been exposed to coronaviruses, but not all of them turn into pandemics like this. And there are a lot of factors that go into that. How safe is it to fly on a plane right now? Ooh, good question. Does anyone have an answer ready?
I could answer that. So air travel, most viruses and other germs do not spread easily on flights because of how air circulates, and it's filtered on airplanes. And so I believe, you can wear face masks and face shields on the plane just to be safe. But I believe it is fairly safe for you to travel, um, within your means.
Thank you. And there are also more guidelines around this. If you go to the TSA website, if any of the CHWs want to pull up, share their screen and pull that up, or pull up other places, the coronavirus-sd.com website also has a section on travel. Right now, there aren't technically restrictions saying that you are not allowed to travel. It's more like everyone should take as many precautions as they can. There are some countries that are not allowing incoming flights from the United States, and there are lists of that online as well. So if you have plans for travel, we just recommend that you check with the airline you plan to fly with, as well as any guidelines of the airport that you will be traveling through, leaving and arriving, and regional restrictions around that too. Different states are having different policies, and so it's kind of being handled locally. So we can also connect with you afterwards. Feel free to email or call any of us from the slide at the beginning of the presentation, and we can connect you with any other resources. And that goes for all questions that may have been asked or not asked, or if you have any that you come up with after this presentation. We're very set up to be able to provide communication with you so that everyone can be as safe in this pandemic as possible. We're also collaborating with other community partners. UPAC is not only the only provider of this county information to particular demographics in San Diego. And we can also refer you to the other programs that focus on different sectors, if that applies to you more as well.
Dominic, I want to add more to the travel. So a lot of people might ask, like, how can you do social distancing on a flight? Or, how when you sit on a flight, on a crowded flight, it is really hard to do 6 feet from each other, right? And so sometimes when you sit for hours, it may increase the risk of getting COVID-19. And so that you should consider those facts before you travel as well.
Thank you. And I just saw this question. Thank you for having your video on while speaking. Any other panelists, if you will be wanting to contribute, there's a request that you turn on your video while you are speaking as well. But we also don't have much time left. It's 4 minutes until the hour. So we want to respect everyone's time while also trying to make the most of it. This town hall is for you. So yeah, so feel free to jump in. And also I'm going to share the screen with an advertisement for our next town hall next Friday. So folks can reference that. Invite others if you like.
Also, if you have any comments about our meeting today, you can let us know and how we can improve.
Yes.
We have another question, Dominic. Will this be different from this town hall?
Next week? Well, we'll be primarily using a lot of the same slides, but we might update it with information as the COVID situation evolves. The slides that we get from the county, we can also give other presentations that talk more about COVID. So this is kind of a sample of what we can do for any other groups virtually. Basically, our role as a program is to make the information we get from the county palatable, or put it in a way where it best matches the communities that we're communicating with. So next week, it will be a different discussion because there will be different attendees, but for the most part, similar information will be presented. The county updates its numbers and measurements for the tiers of how restrictive our economy is every week. And we need to move from tier to tier slowly, but it's possible that there will be 1 week in the future that the county decides to either strengthen restrictions or loosen them. And I can reflect what that means for different parts of our economy and society, different sectors, I can reflect it in the slides, or all of us can, because all of the other community health workers can also give these presentations in their languages as well. And if anyone would like to request a presentation in a different language than shown on the slide here for the town hall, feel free to contact us and we can accommodate that.
There's another question. Next week, can you do a tutorial on how to properly wear a mask and how not to wear a mask, like a demonstration? We can do that, Dominic, right?
Yes, we can do that. And I know it's 12 o'clock right now, so feel free to
I
jump
know.
off if you need to, but I can do that right now too. Let me stop sharing my screen. Now I need a mask, or I can improvise. My hands will be the mask, right? So like it said, you want it flat against your face over the nose bridge. We want to be covering the holes here so that vapor droplets are not going to travel as far as they would if you weren't wearing a mask. So any way that you're wearing it that allows for that free airflow makes the mask less effective, right? So you don't want it under the nose, right? We see that a lot. We don't want it under the chin. We don't want it hanging off one ear, you know. Sometimes on airplanes, people have been caught putting it on their eyes and not their mouth to sleep. And again, pinch that nose bridge if there's a little metal thing that allows you to do so. There are sometimes neck gaiters that are like tubes of fabric that people pull up. And that would technically also create a seal here over your mouth and nose. Sometimes joggers will use that because it's you don't have to mess with it as often. Am I missing anything? And disposable masks are meant to be worn once. So if possible, try to use a reusable mask that you wash every time you use it. Or if you would like assistance with getting multiple disposable masks, contact us afterwards and we can help you with that. As well as community programs that provide help with hygiene kits and packets. I know that for the sector that serves houseless folks, there are hygiene preventative kits being passed out, as well as hand washing stations being placed around the county.
And Dominic, I'm going to jump in as well and just encourage anybody who has further questions to also reach out to their primary care providers or medical professionals. You know, we offer information that were provided from the county. We offer information that is on the CDC website. But a lot of the questions that you guys might have may be a little bit more involved, may require a medical professional or a little bit somebody who's trained in this area. And so we definitely don't want us to be a substitute for going to your PCP, primary care provider, to get those answers as well.
All right, well, thank you very much. Thanks, Josh, for that. And well, have a great, safe rest of your day, everyone. Feel free to connect with us afterwards. Hopefully, we'll see you next week. And stay safe. Thank you again to our interpreters, captioners, and everyone else who helped make this event possible. Bye.
For your time and have a good Saturday.